Good morning. I am Dr. Vishnu Reddy. I am the Chief Operating Officer of Yashoda Hospital, Malakpet. Today I want to tell about the cancer awareness program that we have done at Yashoda Hospital, Malakpet. We have started this cancer institute in Malakpet 3 years back in 2010. And in the last 3 years, we have done a lot of work in cancer in this part of the city. Actually, in this part of the city, that is Malakpet, we have very few cancer treating facilities. Most of the cancer treating facilities are in Jubilee Hills areas and Banjara Hills, but in Malakpet, which caters to a huge population, not only Malakpet local area, but we even cater to areas like Nalgonda, Nizamabad, Nalgonda, Mehboob Nagar, Khammam, Anantapur, Kurnool, and Miryalgura. From these places also our patients come to this hospital. So Yashoda Cancer Institute has been doing a lot of service. Yashoda Cancer Institute is actually a comprehensive cancer institute wherein we have medical oncologists, radiation oncologists and surgical oncologists. That is, a patient who comes to Malakpet Yashoda gets a comprehensive cancer treatment. The patient need not go from one center to the other, one place to the other. We have the latest radiotherapy techniques, like the rapid arc machine we have at Malakpet Yashoda Hospital, wherein we can give very high-end radiotherapy to the patients. We have the excellent diagnostic facilities and state-of-the-art operation theatres, wherein most of the major oncological surgeries are done on our patients. Most important, these are the treatment facilities that are available. More important than this is the awareness that we want to bring about amongst the people that early diagnosis is the key to treatment of cancer. Actually, when cancer is diagnosed at a very early stage, we can easily cure cancer, not only treat, but we can cure cancer. That is the whole idea of this awareness program that we want to bring about. Like breast cancer is one of the most common cancers we see in women of late because of lifestyle changes. Uh, the women are getting married at a very later stage because of their studies, because of career, because of various influences of the society that on them. Therefore, these patients are marrying late and they're having less children at a later age. This is one again lifestyle modification which is responsible probably for more incidents of cancer. So what the advice of cancer experts all over the world is that any woman who is above 40 years need to undergo a breast screening, that is a mammography examination. More than mammography, they have to do a self-examination every month. That will definitely help in early diagnosis. Whenever they do a self-examination once a month, and when they find the smallest of lump, they go to a doctor and get a mammography done. That can pick up cancer at an early stage. When a cancer is picked up at a very early stage, nowadays lot of advances in surgery wherein we do not have to remove the whole breast, but we do what is known as a breast conservative treatment. That is, we remove the actual involved part of the breast, that is the tumorous, and then we immediately subject it to histopathology known as a frozen section. That is, when the patient is still on the operating table, the histopathologists will be able to diagnose and say whether it is a cancer or not first, and if it is a cancer, whether the margins are free. So that way we know that we have removed the entire cancerous tissue, and therefore the whole breast need not be removed. That is the most important advantage of early diagnosis. So cancer is totally cured in this particular patient. But if they come at a much later stage, obviously the doctors will be forced to remove the whole breast. So that causes some amount of disfigurement in the patient and a lot of emotional trauma to the patient. So the emphasis always should be that we have to go for regular screenings and health checks, so that the patients we are sure that we are able to pick up cancers at a very early stage and then treat them accordingly. This is the whole aim, and this is where we want the media, both the print and the electronic media, to bring this awareness amongst the general population. We have invited our famous film personality and social activist, as well as the Member of Legislative Assembly, Mrs. Yashoda Garu, to do this, to bring this awareness amongst the general population. And we are very thankful to her for having come to our hospital and propagating this particular theme of our meeting for today. Thank you very much.